I'm often asked by people when someone should be evaluated for memory impairment. And in the memory disorders clinic, we see a very broad range of patients with that concern. Sometimes we see patients who are a little forgetful and they're wondering if they're going to get Alzheimer's disease like their parent, all the way to the other end of the spectrum when someone may have much more advanced disease and already have a diagnosis of Alzheimer's disease, and they need to come for a second opinion or to address some issues such as behavioral symptoms that may be associated with the disease. So my answer is always, anytime there's a concern, I think it's worth having it checked out to see if that's something that needs to be followed or further evaluated. On the first visit to the memory disorders clinic, we get a lot of history from the patient and caregiver or family. It helps ahead of time if the patient's family is concerned and there may be issues that they're not comfortable talking about in front of the patient, if they can write some type of note or call us ahead of time to let us know their concerns so that we can be sure and cover that during the visit. And then we do physical exam, and we may do laboratory studies or order imaging depending on the situation. It's usually a very comprehensive visit on the first visit. We also address safety concerns. Is the home a safe environment for the patient? Are they driving or cooking or doing things that unsupervised that may be dangerous? So we address those types of issues as well. One of my goals in taking care of patients is to make them and their families feel comfortable. And some of the issues that we have to discuss, symptoms or prognosis of disease, and some of these devastating illnesses that can be difficult for them to open up. So I think it's important for when people are looking for a physician to try and find one that's certainly competent in their field and knowledgeable and has experience in taking care of the diseases, but also perhaps to look for someone that will sit down and listen and involve their family or caregivers in their care.